Choppy. Choppy pa ako, hindi na? Choppy pa ba ako?
Hindi na masyado, Doc.
Hindi na, Doc.
Problema to. Laki-laki ng binabayad ko saan. Alam mo, babayaran ko sa Globe 5,000. Ano ba yan? So, yun. So, marami-rami rin sa inyo yung may mga history of cancer sa family. I think we do family family history, no, sa inyo. Gawa na kayong military. And of course, diabetes and chronic respiratory diseases. So, TNT, AIDS, ano yan? Pneumonia. Ano pa yon? Ano isa? Ano pang isa? Cardiovascular, kidneys, respiratory diseases, or kung gusto niya ng filaria, malaria, schistosomiasis. Pero maano na yun eh. It's okay. And of course, these cardiovascular diseases. Okay? Under the chronic respiratory diseases, you have asthma and COPD. COPD consists of chronic bronchitis and emphysema. No? And the risk factors, of course, is environmental pollutants. That's why meron tayong occupational health din. No? Emotional stress, o sino ba ang mga emotionalist? Time. Kaya mag-exam tayo sa February 6 para free kayo sa February 13. Or sa February 13 na lang tayo mag-exam. Pwede ba sa February 13? Kasi I'm not available February 6. Dr. Balicano, pwede pang February 13?
I have to ask pa po, ma'am.
Yeah. Oo. Kasi hindi ako pwede February 6. I have an international facilitation ng subject among ano. So, hindi ko talaga kaya. Okay? Sino mga emotionally stressed dyan? Pabigay nga ng pusong reaction dyan. No? Over fatigue, kakaupo. Kakaupo. And recently, we have extreme temperature. Ngayon, ang init-init na. First 2 days, tayo ay walang pasok. Pero kami may pasok, except health. And humidity changes, no? So, I presume some of you have asthma attack kasi nga, yung humidity, no? I notice in Tacloban, very humid, no? Very humid, kaya may mga skin problem also, no? Mga atopy. And of course, infections, endocrine change, and genetic disposition. Okay. Number 6 is prevention. And under the prevention and control of non-communicable diseases are accidents, yung mga road traffic injury, and mental and neurological disorders. Mind you, the most common under the mental neurologic disorders are intentional self-harm or suicide, aside from diseases of the nervous system. Suicide was particularly high among the elderly and young adults. Okay? So, di ba I had siguro for this month, kapag na ako ng ilang suicide, ng karamihan toxicology, isa uminom daw ng accidentally uminom ng liquid sosa. Will you believe that? Nakakita na ba kayo ng liquid sosa?
Yes, Doc.
Would you believe? Oh, di ba ginagamit sa CR yun? So I was called, did I share to you yun, yung liquid sosa? Because another, yung napirmahan ko is organophosphate. Ito na ini-spray sa mga fertilizer na polydol. Paano nila natitake yun? Ang amoy pa lang hindi mo na matake, di ba? So suicide is and I believe some of you should take psychiatry or clinical psychologists as one of the specialty. Mag-psychiatry kayo, yeah. City Health Office, meron ba course yung na yung maging former dean, no, not former, future dean of the RTR Medical, hindi na pala pwedeng RTR, kailangan Doña Romualdez Cal Foundation. Okay? So again, under the prevention and control of non-communicable diseases is prevention and control of substance abuse. From drug addict, ang tawag na sa kanila ay PWDs, person who use drugs, no? And under the substance abuse, kasama rin dyan yung alcohol and tobacco. Na-abuse din yung tobacco at saka alcohol. And the highest among the alcohol sa mga parahubog ay ang ARRM, no, sa Mindanao, and Bicol. Next is Bicol. Tapos for tobacco abuse, nabawasan siya because of the sin tax, no? Tumaas na yung ng sigarilyo. Tumaas na yung sigarilyo. Okay? Yes, disease surveillance. Under the disease surveillance, what is happening right now in COVID is every disease of notable disease ay under surveillance. So, through the Philippine Integrated Disease Surveillance and Response. Okay? And then, also, events-based surveillance response, katulad ng nangyayari ngayon sa COVID, ESR, all nakapitsar din siya. And the core capacities that are needed is to detect if it is indeed COVID-19, to assess, and to notify and respond to public health. Kaya nung nangyari, di ba, na ngayon, meron na ngayon, kaya ito, sandali lang.
Pupunta siya dito na lang.
Ay, hindi pwede yun. Magta-transmit pa siya ng ng COVID. Just discuss it. I have a class sa RTR. I'll call back on you, ha? Oo, sige.
Sige, okay.
Okay. That is my, ano na ba yan? Problema, kasi nag-just in na, lumabas na yung mga nag-positive na yung 5 o'clock, kaya ang dami ng tumatawag. Okay. So, next is, pang number 8 is health promotion. So, health promotion is the very, very important. Kailangan talaga invest tayo on health promotion because karamihan ng resistance even in COVID na magpa-isolate, magpa-quarantine, or even the vaccine hesitancy is due to health promotion. Kaya kailangan yung risk communication. At karamihan din naman ng diseases, di ba, sasabihin nyo palagi, tigas naman ng ulo nyo, manang, tatang, tagas ng ulo, di ba? O yung mga lolo-lola nyo, hindi umiinom ng mga maintenance medicine. Kaya tuwan-tuwa ako pag may mga pasyente na very compliant, no? Even in TB, grabe, kasi makatikim ng gagaling, or yung mga nagse-self-medicate. That's why Health promotion help influence behavior towards improvement of family health and prevention as well as management of communicable diseases and NCDs. TB is still a stigma. So meron akong friend, nurse na nga siya eh. Nurse na nga siya. No? So yung kanyang worker, meron silang business, yung kanyang worker is nag-positive sa TB. Ayaw niya nang papasukin, pero 4 months naman nakainom. Sabi ko, pwede na, kasi hindi na siya nakakahawa. Hindi na nakakahawa yung na may medicine, hindi na nakakahawa yung pasyente. Okay? So the 3 basic strategies identified by the WHO in the Ottawa Charter is advocate to make political, economic, social, cultural, environmental, behavioral, and biological factors favorable to death. No? And then enable people to achieve their fullest health potential through access to information, life skills, and opportunities for making healthy choices. For example, yun na nga in terms of, alimbawa, yung iba gusto ng family contraceptive, so bibigyan mo sila ng opportunity. And the number 3 is mediate between differing interests in society for the pursuit of health. Katulad nun, marami ang sa Pilipinas, only about 40% would like to be vaccinated. Yung iba, they want wait and see. Okay, sino, if ever kayo sino ang gusto magpa-immunize dito ng COVID-19? Sino? Give me ano bang mga reactions dyan?
Depende sa manufacturer, Doc.
Ayun, depende. Okay. Yung iba, magpapa-immunize kayo or hindi, wala mang nagre-respond. Doctor, D lang. Okay. Sino magpapa-immunize? Ha? Pag magpapa-immunize kayo, give me a clap. Give me a clap. Clap, clap. Clap, clap. Wow, marami rin magpapa-immunize, ha? Okay. Ako hindi. I have to wait and see first. Kasi first 6 months, trial ito lahat, ha? The first 6 months of the vaccine to be immunized, to be inoculated sa Pilipinas ay trial pa. I'm praying kasi for emergency use lang ito. So 30% of the population will be inoculated. Okay, 9 is disaster and health emergencies. Philippines is the 3rd most disaster-prone country next to China and US. So number 1, China, pangalawa US, pangatlo, pangalawang US, pangatlo ang Pilipinas. So, from 205 to 220 to 10 years yan, study ng United Nations Office of Disaster Risk Reduction. Kasi maraming sa US eh. Okay. Number 10 is, of course, essential health products. So, medicine and health products are indispensable to the prevention, early detection, and treatment of diseases. Okay? So, ito yung mga importanteng mga law para ma-ensure there is available medicines and, of course, quality. The Generic Act of 1998, the RA 7581, Price Act, which mandated the DOH as the lead agency in identifying essential drugs as basic necessities and in monitoring their corresponding prices. No? Second is, kaya ngayon medyo bumaba yung mga medicine because of this. RA 9502 of 2008 is the Cheaper Medicines Act, which intended to promote and ensure access to affordable quality medicines for all through an effective competition policy in pharmaceutical sector. And then the Medicine Access Program of the Department of Health is a strategic mechanism in addressing the needs of vulnerable patients, especially the poor. Okay. And then another is health facilities. Under the health facilities, there are channels of service delivery in the Philippines, such as private hospitals, clinics, and providers, government facilities. We have the DOH hospitals, we have the specialty centers, NKTI, Lung Center, Philippine Children's Medical Center, Philippine Heart Center. 5 yan sila eh. And, saan pa ba? NKTI lang. lang children's heart, ano pa isa? And hopefully, sa Davao magkaroon ng cancer cancer center. And of course, yung LGU managed hospitals, RHU, and BHS. So under this is the health facility enhancement program. Okay. So another package is the human resources for health. No, there are 6 programs in HRH. Under the HRH is the medical pool placement and utilization program. Ito yung mga siguro pag doctor na kayo, this is one option. You will be we have ano ba siya? Neonate, oo, neonate, and then psychiatry doon sa PGH under the MPPUP program ng Department of Health. So, siniswelduhan sila ng EVRMC, yung item nila, pero doon sila nagtitraining sa PGH, no? And then they will be assigned back to DOH hospitals and provincial hospitals. I think 1 per 3 years. So, another is the DTTB program, 2 years, primarily to 4 to 6 municipalities. And of course, the nurse deployment program, the rural health midwife program, the RHTPP is the rural health team placement program. Ito naman yung mga dentists, medtechs, and nutrition and dietitian. And the DOH pre-service scholarship program for doctors and midwifery. No? Meron ito. Wala sa nursing kasi maraming nursing. Ayaw nila yan dahil karamihan ng mga nurses aalis naman ng bansa. Okay? Next is we can achieve this through the service delivery network. It refers to network of health providers from both public and private sector within a province-wide or city-wide health system, offering a core package of health services in an integrated and coordinated manner as a form of health referral mechanism. So lahat na to through the universal healthcare that I have discussed before, kasama itong service delivery network. Okay. So, the implications of this, if we will not fulfill those indicators, is the challenge is still the limitation in health service packages and facilities standards, especially to non-communicable diseases. So, buti nga nagkaroon ng na neutralize ito ng konti kasi ang dami-daming medicines for hypertension. And of course, inequities in the access of health goods and services such as geographic barriers and to conflict-affected areas. Maano pa rin yung mga GIDA areas and yung sa may mga terrorism or conflict-affected areas. Inadequacy and maldistribution of health personnel. So karamihan nasa Mega Manila, NCR, doon sila nagpa-practice. And the fragmentation of health service delivery system. And because of this challenges and implication, medyo we wanted to have targets by 2022. And these are this, no? So first target dun sa mga minention natin, access to those is una, we hope to have MCPR, no, contraceptive prevalence of 30%, no, from 24.9 to 30%. We want to decrease teenage pregnancy, no, adolescent birth rate to 37, no? Kasi lately 57 mas mataas ngayon. 2017 yung last, I think it's about 70 to 37 yung target sa 2022. For the fully immunized child, it's still 95%. For the incidence of low birth weight among newborns, kaya meron na tayong first 1,000 days is 15% na lang. Road traffic deaths per 100,000 from 8.6 to 7.9. So these are the targets. The prevalence, no, of raised BP. So ang ngayon, we have to take the blood pressure from 18 years old and above. Although dapat pati mga bata kinukuhanan din ng blood pressure. Okay? For the tobacco, from 23.8 to 2022 to 18%. And then treatment program, kailangan 88% of people who abuse drugs or people who use drugs should be 88%. For TB treatment, kailangan 90% of those with TB, kailangan natitreat sila 90%. And then for the HIV/AIDS is the antiretroviral therapy coverage should be 85 kasi medyo mababa. 47.65% lang tayo. So we need 85. There are 81 provinces, no? 81 provinces in the Philippines that has malaria. And only about 32 out of 81 pa lang ang malaria-free. So we wanted to increase it from 32 to 74. That is 91%. Okay? And for the filaria, for the there's about for all those all those municipality with filaria, only about 35 no out of 46 sana maging 100% na. Okay? For the environmental and occupational health, proportion of household using safety managed drinking water services from 25.8 to 62.5. Proportion of household using safely managed sanitation services. Imagine ha, yung sa CR, mababa 6% lang ang buong Pilipinas. So we wanted to increase to 53%. So marami pa rin yung walang sanitary toilet, no? And then prevalence of current tobacco use from 23.8 to 18%. Sana yung inyong mga family na nagsusmoke ay kasama sila sa magdi-decrease for the prevalence. And the last but not the least is treatment program. Tapos na pala yun. Okay. That's it. Any question? So, ano yung mga, I think mas maganda na makaisip na kayo ngayon ng inyong mga diseases for your health promotion, either through skit or ito dapat talagang lang, maximum of 3 minutes to 5 minutes is the most na. Kaya nga 3 minutes. Tuberculosis, pneumonia, drugs, HIV, yun, HIV/AIDS, TB, cardiovascular, chronic respiratory, what else? Sino may gusto ng ng COVID-19? Okay. Question? Merong pangutaan. Any questions so far? Yung 10 na 112. So, meron na namang siyam na absent. Okay. So, kung wala na, Dr. Belicano, can you just submit the attendance?
Yes, Doc. I'll send it later po.
Okay. So, siguro for the group leaders, you can start submitting your topic, TB, yung mga dun lang sa nabanggit na malnutrition, especially focus on stunting. What else? Pwede rin yung environmental, no? Environmental health, which is okay? So with that, thank you, ma'am.
Doc, excuse me po.
Yes.
When is the deadline po
Yes.
pag-submit ng cases per group?
Pagsasubmit lang naman kayo eh. Bukas. Hindi, pwede namang next week.
Okay
Pwede
po,
namang
Doc.
next week. Kasi after bi-monthly, tsaka siguro tayo makaka-start. Kasi para ma-discuss ko yung communication nila. Hopefully matapos natin February. Ilang weeks pa ba tayo? Kailangan matapos natin up to the biopsychosocial.
2 weeks pa po, Doc.
2 weeks pa, sige. So we still have 4 meetings, right?
Bali, 5, Doc,
5
including
pa,
tomorrow.
plus including tomorrow. Okay.
Yes, po.
Oh, meron na ako group 3 COVID. Pakisulat na lang ha, group 3. Very good. Very
Okay
good
po.
group 3. Congratulations. Dr. Belicano, pakisabi hindi talaga ako pwede February 6
Okay
for
po.
the exam.
Yes po, Doc.
Hindi ko kakayanin. Oo. Okay. Pag international kasi medyo, oy, drugs, substance, Dr. Bargamento, when you say huwag niyong gagamitin yung drugs, substance abuse, ha?
Yes po, Doc. Sorry.
Don't use, kasi, huwag kang gagamit ng drugs.
Substance abuse, Doc, including yung alcoholism.
Pero kasi siya kumbaga, usually, yung nagda-drugs, nag-alcohol din naman, tsaka nagsisigarilyo.
Okay,
So,
Doc.
dapat, when you do the promotion or behavioral change communication, kasama yun, di ba?
Okay, Doc.
Pero you can focus on drugs if you want to. Substance abuse, pwede man, drugs lang. Okay? Pag-pray nyo nga si Mamu G, I'm so tired. Sitting from 8 to 5 of the training for the COVID. My God, nasusuka ako. Pero very important yung training kasi ito yung dinidiscuss namin yung planning, yung mga hesitancy sa vaccine, lahat about COVID-19. Oo. Kung paano ka mag-empathize, tapos kung paano ka magko-compute ng mga projections, pati wastage, masakit sa ulo. Okay? Can I say bye-bye now? Okay na ba?
Bye, Doc.
Okay po.
Thank you, Doc.
Thank you, Doc.
I
Thank you,
mean,
Doc.
love you.
Love you,
Take
Doc.
care, Doc, always.
Take care of yourself,
Happy New Year.
Doc.
Ingat po.
Alam mo,
Pahinga ka
thank
na po,
you.
Doc.
Hindi pa, meron nga ako 6:30 na meeting eh. Ba yan? Actually, I cannot get hold of this class kasi you are very important to me. Tsaka basic talaga ngayon, ang challenge talaga ngayon is on the public health. Kaya congratulations for taking the challenge. Kahit yung iba wala pang NMAT, no? Kayo talaga yung pinakamapalad. Oh, yun no, meron na Group 12 TB. Okay, with that, bye-bye. Magre-rest ako ng kaunti before my next meeting. Love you.
Thank you, Doc.
Thank you, Doc.
Thank you,
Thank you,
Doc.
Mama G.
Thank you, Doc.